Hello. Now we shall understand what is pharmacy practice. How do you define a term pharmacy practice? We are very well known about the medical practice or the alternative system of medicine, that is Ayurvedic practice. But in India, we are not aware of the pharmacy practice. What exactly is pharmacy practice? The pharmacy practice does not take place in a vacuum, but in the healthcare environment, it aims to improve health. So health is a very broad concept which can embody a wide range of meanings from technical to moral and philosophical things. It is perhaps the most important human resource, isn't it? So, moving on to the definition of pharmacy practice, what actually is the pharmacy practice? Let us understand that from the beginning. Pharmacy practice is a very broad region which encompasses many things which is associated within it, which includes maybe from clinical perspective, maybe from hospital perspective, maybe from the community perspective point of view. So if I want to take it all the things, so it includes interpretation, evaluation and implementation of medical orders, dispensing of prescription orders, drug orders. Pharmacy practice includes the participation in drug selection and device selection. The pharmacy practice, which includes drug administration, drug regimen review, medication therapy regimen review, practice of telepharmacy, which is a very latest concept within across state lines, drug and drug-related research, conducting a thorough research on drugs, conducting projects on drugs, maybe drug evaluation studies or drug use evaluation studies, what happens in the hospital to improve the prescribing habit of the physicians, the provision of patient counseling, which is one of the fundamental responsibility of clinical, community or hospital pharmacist. Mainly, the pharmacy practice focuses on the primary care or the collaborative care practice, which happens in multidisciplinary team. So, this may happen in case of the compounding, labeling, and proper storage, record maintenance in case of community settings, community pharmacist. So, overall, the description of pharmacy practice, if I want to tell you in sentences, is optimizing the patient safety, optimizing the efficacy, safety profile of the drug therapy by giving the qualitative services by implementation of effective use of technology and the competent training. So you are optimizing the drug therapy in the patient. So what is need for optimization of drug therapy? To improve the patient safety, to minimize the side effects as far as possible. Then you are giving the holistic care services to the patient by reducing his burden of the disease, and by effective implementation of latest technology, all the softwares and the competency based training, you become thorough in giving the holistic care services. So pharmacy practice, which includes all the three things, which may be the hospital pharmacy practice, which may be the clinical pharmacy practice, which may be the community pharmacy practice. So it's a very broad region where the pharmacist is practicing in whether it may be in hospital settings, whether it may be in community settings, whether it may be in clinical settings. So each and every region, he can apply the principles of the practice into the working area. That is pharmacy practice. If the practice is applied to the clinical area, then you may be thinking of this thing, drug and drug related research, the provision of patient counseling, the bed patient counseling to the patient, the primary care or collaborative care approach to the patient by optimizing the drug therapy to the patient. If I want to tell the same practice, the pharmacy practice, when it is applied to the community settings, it becomes compounding, labeling, proper storage of the drugs and devices. He has to maintain the record maintenance, reporting unusual adverse drug reactions, which happens in both in community, it happens in clinical settings, it can happen in hospital settings also. So here, in case of hospital pharmacist, the pharmacist is actively involved. He is participating in selection of a drug or device, which has to be kept in the hospital formulary, which has to be deleted from the formulary. Okay, so carefully he is interpreting all the things, he is evaluating and implementation of medical orders, and he's dispensing the prescription or drug orders in case of hospital pharmacist, isn't it? So it is a wide region, broader area, which focuses on whatever the activity which is pertaining to what he is doing actually, whether it is community, hospital, or the clinical settings. Having defined about the pharmacy practice, what actually it is, now let us move to the understanding what is healthcare delivery system in India. Before the initiation of the topic, this may be the preamble to understand the healthcare system in India. Let us now jump into it and let us understand how the healthcare services are operating in India. Yeah, learning objectives of this session would be, upon completion of this lecture topic, you should become thorough and you should be able to define and describe the healthcare delivery system in India, introduction of pharmacy education in India, what is healthcare system as per different levels, history of hospital pharmacy, evolution of hospital pharmacy, salient features of hospital pharmacy, problems in the development of the modern hospital pharmaceutical services, meanings of producing capable hospital pharmacists to handle various facets of services. Now, coming to the introduction part. Since the primitive times, human civilization has gradually undergone various changes, and today what we find is that civilization has become highly specialized and complex, reflecting quite a good scientific, social, and technological developments. The ability and wisdom of human beings has been striving to construct a society which could protect health and render overflowing welfare. The hospitals have evolved as the centers of community health, isn't it? The Indian Medical Service was essentially a military service, though a large number of its members were generally in civil employment. The Western medical education originated in India through Indian Medical Service. Initially, it was the Christian missionary organization which established Christian Medical College and Hospital in Vellore before the advent of independence of India in 1947. Other leading hospitals were also established by Christian missions in Chennai, Andhra Pradesh, Gujarat, Punjab, etc. So, when we see the health system in India, it was started essentially as a military service. Okay, then mainly there was Christian missionary organization which came into establishment in 1947. That we can understand where the independence, before independence, the British were ruling, and the Christian missionary organization which established the Christian Medical College in Vellore, and which happened in 1947. Other leading hospitals were also established by Christian missions in Chennai, Andhra Pradesh, Gujarat, Punjab, etc. The fact that business interest plays no part in the delivery of care to patients in such institutions led to eventual division of labor in the physician's apothecary functions. This in turn resulted in the recognition of pharmacy as a discipline separate from medicine. Since the division occurred in hospitals, the hospital pharmacist was first recognized professional person in the pharmacy. The Britishers were successful in introducing, developing, and consolidating the Western medical system, but the system almost completely ignored the pharmaceutical sector. What we can notify here, there is a main thing in healthcare where business should not come into a role, because you are delivering a care to the patients where it is not a business. But division happened, okay, and there is a apothecary functions which takes place, physician and apothecary functions, that is a separation, so that a recognition of pharmacy as a discipline made into separate. Earlier, what was happening here? The compounding and dispensing activity were carried by the physician. So he used to diagnose the thing, the physician, and again he used to compound and dispense the medication. So there was no cadre of pharmacist over there. But after this apothecary functions, when the drug has been made separate, now separate system came into existence, and the first pharmacist that recognition got from hospital, that being a hospital pharmacist. Okay, and this was developed by Britishers because we were under the British rule, and they were successful in implementing and introducing and bringing the Western medical education system and bringing the implementation of this hospital pharmacist. Although concept of hospital first came into existence prior to 1000 BC, however, our present day hospitals in India have yet to reach the stage of development reached by hospitals in Western countries. The hospitals located in urban areas, especially in the metropolitan cities, show some progress in this direction of modernization of their services, including in the field of hospital pharmacy services. The separation of pharmacy from medicine in India took place in charitable institutions, firstly, operated under government of other authority. Okay, so what happened? Firstly, we can see this hospital, the name first came into existence in 1000 BC. Okay, prior to 1000 BC, and India is in stage of developing. Okay, we are not yet developed completely. If you see and if you try to understand the Western countries, they are highly developed nations. They have their own policies. Their practice of pharmacy in hospital is highly specialized. They give hospital pharmacy services in a very sophisticated manner. But we are having many lacunae in our hospital because we are not that much well trained. We are not that much systematic in giving the hospital pharmacy services when compared to developed countries. Okay. In 1931, late Professor Mahadev Lal Shroff established BSc in Pharmacy course in Banaras Hindu University, BHU. He is the first person, he is a father of pharmacy, who has introduced BSc in Pharmacy in BHU in 1931. Late Professor Shroff received all encouragement from Mahamana Madan Mohan Malviya, a great patriot born and established such courses in Madras Medical College in the year 1941. Okay. At the time, only 3 to 5 graduates in pharmacy, B.Pharm, from the University of London and Manchester were available. In 1941, a post of hospital pharmacist was created in the KEM hospital in Mumbai by late Dr. Jivraj Mehta. Later, attempts were made to create modern pharmaceutical services in the government, municipal, or privately run hospitals. So, we have to remember some of the famous personalities like Madan Mohan Malviya, a patriot, and the father of the pharmacy like M.L. Shroff, who is a person who made this course, who has introduced this B.Pharm course. Okay. Some of the leading hospitals in the country which provide modern type pharmaceutical services, including the elements of clinical pharmacy, are Christian Medical College Hospital in Vellore, Jaslok Hospital, Mumbai Hospital, Sir J.J. Group of Hospital, Mumbai, KEM Hospital, Nair Hospital of Mumbai Municipal Corporation. Recently, Escort Hospital, Apollo Hospital, and Mayo Hospital have come up in different cities with relatively modern facilities, including clinical pharmacy services, were given in these hospitals in a very highly specialized manner. However, even in these hospitals, the type of clinical pharmacy services as is provided by modern hospitals in the UK and USA are yet to be developed fully. So we are in the stage of development because the pharmacy practice, especially the PharmD, was introduced in 2008. Still it is emerging science. It has to be developed and it has to go to that level how USA and UK, how they are operating and how they are giving the services in terms of clinical pharmacy services or hospital pharmacy services to the patient. Now, this is the overall picturization of healthcare system in India, how it is operating. On the left hand side, we can see the levels, different level, whether it may be the village, town, small city or city. Here we can see the place of health services given. Here we can see in charge for medical, in charge for pharmacy, intermediate to government, from intermediate to government, who is taking care, who is involved in government, whether it is government or some person who is involving, who is just like acting like a government, and it is a government level involvement, whether government level involvement is there or not. Okay, now let us understand this, the graph. Coming to the village level, the first level, where the place of health services is private dispensary hospital, and in charge for medical faculty may be doctor, who may be from non-MBBS background. And here there is no pharmacist. And coming to the intermediate to the government, here there is a sarpanch who is involved as a intermediate to the government. And the government level involvement is totally negligible in case of village. Next, moving to the town, where we can see the place of health services, which is nothing but PHCs, primary healthcare centers. Okay, and in charge for medical person may be the resident doctor, who may be MBBS, and other doctors who is helping this doctor, resident doctor, because it is town. And here in charge for pharmacy may be compounder. Earlier they used to call the compounder, okay, one who is compounding the preparations, drugs or preparations. Nowadays, there is no compounder available. Always it is the D.Pharm. Okay, the person who is qualified as diploma in pharmacy and his name has been registered in state pharmacy councils. And intermediate to the government, here may be the chairman or senior division manager. Okay, and the government involvement, here it is the Ministry of Health. Okay, coming to the small cities, again, it may be the primary healthcare centers or government general hospital in small cities. And here the in charge person for medical may be doctor, senior medical doctor, who may be the medical officer. He may be from chief, or he may be a chief surgeon who is having a qualification of doctor of medicine or master of surgeon. Okay, from these specialties who may be a medical officer. And in charge for pharmacy, whether he may be having a diploma in pharmacy education or B.Pharm, and he should be registered his name under state pharmacy councils. And intermediate to government, he may be a chairman or senior division manager, and it will be directly under the Ministry of Health. Coming to the city, here again the place of health services will be given by civil hospital or municipal corporation hospital, big cities. And here there are MS who are called to be as medical superintendents. All specialties and surgeons will be there in charge for respective in charge, and the surgeon will be he will be the medical superintendent. Okay, the surgeon is the superintendent who is the chief, and he is a medical superintendent. Under his orders, all the doctors, whether he is the physician or community medicine, whatever the department may be there, he will be directly working under the instruction of medical superintendent. And in charge for pharmacy, hospital pharmacist will be the B.Pharm. And intermediate to the government level, here mayor or director of medical services or commissioner of food and drug control administration, he will be the intermediate to the government services, who is the in charge person. And the government involvement here, it is directly under the Ministry of Health and Family Welfare, secretary or joint secretary or commissioner level. That is the involvement of government here. Now coming to the history of hospital pharmacy. Now let us understand the history of hospital pharmacy. In USA, Pennsylvania Hospital was the first hospital in colonial America in 1752. At that time, medicine and pharmacy were practiced commonly together in community, with the drug preparation often the responsibility of medicine apprentice. So medicine and other things will be prepared by the responsibility of medicine doctor, medical doctor. Hospital pharmacy practice never developed until 1920. In the early 20th century, there was a division of labor, and the hospital pharmacists were given the traditional focus on compounding and preparation of drugs, and impetus on improvement of product quality and standardization. Later, hospital formulary concept came up, and by 1930s, pharmacy-related issues in hospitals were handled by American Hospital Association. So they made an association, that is American Hospital Pharmacist Association. They have developed the formulary, okay, in the 1930. Now, evolution of hospital pharmacy. A number of years ago, Franke et al. Stated the dispensing function of the pharmacist, while important and even vital, is essential superficial practice of the profession, which by itself does not require knowledge or skills basic to merit professional recognition to the depth that lies within the grasp of hospital pharmacist. So what he is telling, Franke et al., just mere dispensing does not fetch anything. So mere dispensing of drugs or the pharmaceutical substances will not increase the charm of the hospital pharmacist. He should go to such a level where he can give the services to the society. By giving the services to the society, he can uplift or keep up the image in the society. The above observation was a forecast for pharmacy's future new role. For less than 10 years later, pharmacists assumed important new roles, those of clinical pharmacists and drug consultants. Okay, from the just mere act of dispensing, they moved to the super specialty pharmacies, consultants and specialty pharmacists, whether it may be the cardiovascular, nephro, or whatever area it may belong, and they started their recognition of their role in the society by giving the clinical pharmacy services to the needies. To be able to alter these positions, it has become necessary to alter the pharmacist educational pattern and work habits. So, if you want to have a powerful, good image and good charm in the society, you should become highly educated. It doesn't mean that you are educated, you should become highly skilled for particular things. So, with proper education, practice, and skills, and you can become professionally competent pharmacist. Now, let us understand some of the salient features of hospital pharmacy. Hospital pharmacy is the department or a domain in the hospital or an organization which is under direct supervision of a professionally competent, legally qualified pharmacist and deals with supply of drugs, medicines, and allied products to the nursing units and other such services, filling of special prescriptions for ambulatory and outpatients, and dispensing as per the intention of the physician, manufacturing of the drugs and formulations in bulk, particularly the large volume parenterals required for use of indoor patients, storage and dispensing of narcotic products and biologicals, supply and storage of ancillary products and articles required in the hospitals. So what we can see here, the pharmacist has moved now and he has become a legally qualified person who can exchange his information, his knowledge to the patient. He can counsel the patient regarding about the drugs and other things. So he can prepare in big hospitals, in national hospitals like multi-care hospitals, the super specialty hospitals, where the pharmacist is involved in preparation of large volume parenterals and he's labeling the large volume parenterals for the use of indoor patients. He should know, he should try to understand, and he should always protect the requirement of the patient's confidentiality and whether it may be a storage and dispensing of narcotic products or biologicals. Now, let us move to the problems in the development of modern hospital pharmaceutical services. What are the major problems? What are the major obstacles in the way of our hospitals developing and providing the type of services which is given now? The medical profession fails to realize that a modern competent pharmacist is in a position to provide the type of services described above. The financial benefits as a hospital pharmacist are very less to attract young pharmacy graduates to adopt hospital pharmacy as their career of choice. Our universities and pharmacy colleges have not shown great enthusiasm to impart adequate technical knowledge and training in the academic course for the subject or the contents of degree course in pharmacy syllabus. So, until and unless if you don't promote what is the pharmacy practice in case of hospital pharmacy settings, what is their career, how you become hospital administrator with hospital pharmacist, and all those things which is not provocating and which is a major obstacle because our degree course does not take any initiation in developing or building these capabilities. Now we shall understand the means of producing capable hospital pharmacists to handle various facets of services. Education of high quality and standards is one of the important means of achieving the above objective. The primary aim of education for specialization in the hospital is to prepare qualified pharmacists to render all elements of institutional pharmaceutical services in the interest of the better patient care, which is one of the prime objective in hospital. So a strong foundation on broad, general, strong professional education is very much essential for realizing the objective. More specifically, the well-qualified hospital pharmacist should have thorough knowledge of drugs and their actions, So besides proper understanding of the biological and physical sciences, he should be having a deep understanding about the chemistry, pharmacology, toxicology, and various routes of administration, stability, and other information regarding drugs that he can remain in close association with the medical staff. Because the hospital is an excellent institution where there are different faculty members will be there, and the physicians will be having many doubts in the hospital regarding about the update information about the drug therapy, the new drug development, all these things where pharmacists should have sufficient knowledge regarding about the advancement in the pharmaceutical sciences. So he should continuously update his skills and knowledge, which is the main task of hospital pharmacist or clinical pharmacist. But when you compare these things with the outside pharmacist, he is not having that knowledge actually. I want to say here, the outside pharmacist may be having knowledge, but he is not handling, if I want to tell an example, the radioactive isotopes here. Whereas in hospital, there may be a radiology wards where he is handling the radioactive isotopes. So he should be having a thorough knowledge about radioactive isotopes, how it has to be used and other things. So he should keep on updating himself regarding about the drug and whether it may be the handling of drugs and other things, which is a patient care services to be rendered by hospital pharmacist. Hospital professional staff are mostly specialists, and therefore usually the medical team will be looking a very keen interest on the hospital pharmacist. The doctor may expect something from the pharmacist. So by conducting pharmacy and therapeutic committee, he can become like a decision maker. Which drug has to be kept in the formulary, which drug has to be deleted from the formulary. By analyzing of the drugs, whether it may be the pharmacoeconomic analysis, whether it may be the pharmaceutical quality of the drugs, whatever it may be, it is the responsibilities all lies on the hospital pharmacist on the selection of suitable product in the hospital. Secondly, an ability to develop pharmaceutical manufacturing organization. Here, the quality is essential because the quality is always paid. Considering the qualities of drugs are required for the treatment for the patients in the hospital, and as well as in the outdoor as well as indoors departments, in the present condition of uncertainty with respect to the availability of certain drugs, it becomes necessary for the pharmacist to produce them in the hospital. Besides this, a physician or a surgeon may at any time demand certain preparations which are not commercially available, and therefore it is the pharmacist's responsibility to prepare them at short notice and supply them with proper time. An adequate knowledge and information on control procedures. Considerable quantities of drugs are localized physically outside the pharmacy, such as at the nursing stations, wards, etc. Supply room and clinical units. Thus, it is necessary to have controls for internal distribution of drugs for him. The control procedures may vary from hospital to hospital. The patient who is hospitalized may require intensive drug therapy, require control procedure which will allow rapid rechecks of drug sources and quality. The potentialities of automated dispensing at the ward level bring further emphasis to establishment of correct controls for drug distribution in this situation. Next point, ability to administer and manage a hospital. See, the pharmacist is acting like an administrator and he is totally involved in managing the whole hospital. Broad areas of a hospital pharmacist's administrative and management responsibilities may comprise many of the things. Okay, let us now understand one by one. planning and integrating pharmacy policies with medical, nursing and other services. So it becomes utmost necessary for the pharmacist to plan and integrate with other staffs, whether it may be medical staff and other nursing and other services whenever required. So he is acting like a administrative authority in liaison between medical and nursing staff. So in the both the horizontal level and at the vertical hierarchy, and he should develop and maintain live lines of an active communication with them. He must be able to prepare proper written information to the hospital staff in order to bring to their attention whether it is relating to the drugs and their effectiveness. Personal appointment and supervision. The chief pharmacist is also usually responsible for interviewing, selecting and evaluating the staff members for work in the pharmacy. He organizes and prepares schedules for their work. He is also responsible for their training and development, and in most cases prepares their performance evaluation and recommends promotion. So the chief pharmacist, who is like personal appointment and supervision, is acting like a supervisor. He must be capable of understanding the things, how the things are going on in the hospital. Next one is stock control and record keeping. The pharmacist, the responsibility lies on how to control the stocks and how to maintain the records properly. It becomes duty of the pharmacist to check records periodically, and sometimes special records will be sent to the management, and in case of some enquiries, and he has to maintain the data at all times. These reports should usually include reports on prescriptions and controlled drugs which has been dispensed, drug purchases, inspections and improvements in operations, and other such aspects with demand whenever there is demand arises, and the attention. The hospital pharmacy is acting like a decision maker in case of charging policies for pharmaceutical services. So he should also be able to implement an adequate system for stock and inventory control system whenever required. The hospital pharmacist is involved in budget preparation, isn't it? He is responsible for justification, accountability, and expenditure of his department's financial matter and monetary funds whenever allocated. He therefore must be very keen, and he has to analyze and interpret the trends and tendencies of the prescribing and economic impact of new drug development, which for budgeting purposes render useful for his forecast of future drug expenditures. So therefore he should be in a position to analyze and interpret prescribing trends and economic impact of new drug development. The pharmacist should be having the ability to conduct teaching and in-service training scheme. That happens in the hospital. The chief pharmacist or pharmacist under his direction plans and presents the pharmaceutical contribution to teaching activities in hospital and other such premises. He may prepare lectures and demonstrates for nursing staff covering such aspects like storage of drugs, proper use of drugs, dosage forms, and pharmaceutical calculations involving conversions, percentage, solutions, and calculation of various dosage forms, dosages. Various aspects such as prescription writings, drug usage, and incompatibilities may be presented to the medical staff or to the medical internees and residents whenever it is required. Nextly, the pharmacist is actively involved and to conduct and participate in research activity. So the hospital pharmacist role is a very broad, what we have understood now. He is conducting research and it may be of two types, two major types in the hospital. One is participation as a team member in medical research, one thing. Another thing, performance of a pharmaceutical research. So sometimes it may be both, may be combined together. Sometimes he may act like a co-investigator and he's helping the principal investigator in the research activity. And he may be telling various advices and assisting the principal investigator while giving the information regarding about the pharmacology, posology, toxicology of the compound which is under trial. Okay, so in the field of pharmaceutical research, his scope is to make improvements in the usefulness of pharmaceutical preparations, developing methods for preserving and stabilization of drugs and pharmaceuticals. So improvements of what are the pharmaceutical vehicles he has to add in the preparation. Improvements of taste and increasing therapeutic efficacy. What is the role of the pharmacist when a drug is first developed or is being first evaluated? So his role is very, very unlimited type of role. He is mainly exploring himself in the world of the hospital by conducting or by implementing his knowledge of drug therapy. Lastly, the concluding statements. Education is a prelude to the life, the experience of learning. With rapid progress in the pharmaceutical and medical sciences, the ability to read and professionally and technical literature is imperative. In fact, it means that hospital pharmacist must maintain a regular habit of writing. Similarly, of added importance is associated with his participation in more formal activities of continuing education aspects. If it does not only mean his participation in conference or some other symposia, etc., directly related to the pharmacy, but also in overall hospital activities aimed at all staff members through departmental seminars and other educational media. It is this continuing growth and association as a colleague on the health team that will enable the pharmacists in today's hospital to provide better quality of pharmacy services in years to come. So with this, I want to conclude my statements. In the healthcare delivery system, the pharmacist plays a great role giving all the pharmaceutical care services which happens, providing a patient care services to the hospital, to the needy. The pharmacist should attempt to keep pace with the rapid change. He should keep on reading himself with rapid change which is taking place in the world. If he is to fit into the changing panorama, he has to convince his associates who may be not aware of the advantages gained from the better type of giving the pharmaceutical care services. So he has to uplift his knowledge. So I've used the word, it is a type of riding always. Okay, and medical sciences is always changing science. There is always new technologies, new drug therapies, new diagnostics will be emerging very, very fast. So he has to update his knowledge regarding about the drug therapy, regarding about the continuing education and all those things which is required for his professional growth. Okay, that concludes the healthcare system which we have seen today, which is a great thing. And we have tried to understand the whole thing, how the pharmacist, what all the pharmacist positions and what all the healthcare delivery system, what is the role of the pharmacist, how the pharmacist concept came into existence, and how the healthcare system, whether it may be in case of village, town, small city and city, how we are going to tackle such problems, and what is the role of hospital pharmacist over there. We started our journey from history of hospital pharmacy, then we have moved on to the evolution of hospital pharmacy, then later we have understood the salient features of the hospital pharmacy, which includes the supply of drugs or medicines and allied products, filling of special prescriptions. We have understood manufacturing of drugs and formulations in bulk. We have seen some of the salient features which is required for hospital pharmacy. Then we have seen the problems in the development of modern hospital pharmaceutical services. Okay, which are all the problems he has to face in modern world. Okay, the universities don't provide proper education to the technical education is not in a good manner. It is not provocative. The financial benefits for the hospital pharmacist are too less, so that he is becoming less attractive to the hospital pharmacist position. So many graduates, after completion of their degree, they are going to the production of some other things, where they are not going to the ladder of hospital pharmacy, where he can complete his MBA and he can become the hospital administrator. That is one of the most demanding position in the hospital. Having said that, I would like to conclude this session, and next session we'll be seeing soon. Take care. Thank you.